I'm Dr. Christine Horner, and I am the owner of Dr. Christine Horner's Medical Thermography Group of Southern California. I find that people are so confused about what medical thermography is. And so what I'm going to do with you today is go through an explanation that I hope is going to be extremely helpful for you in understanding what medical thermography is and why it is so important for your preventative health. So I'm going to screen share into a PowerPoint, and give me just one little second here for that. Okay. So as I said, most people who have had medical thermography done tend to be still very confused about exactly what it is and what it shows. And that's because medical thermography is something that gives us completely unique information that no other test does. It's considered a physiological test, not an anatomical test. All the other kinds of tests that we have or scans for the bodies are anatomical. So I'm going to spend a little bit of time going over the distinction between a physiological test and an anatomical test. So if you look at this image of a head, you might think, okay, anatomically, it looks like a head, but it actually is all an illusion. Again, this is a physiological test. So what happens with the infrared camera, and at its most simplistic level, all it's doing is measuring the surface temperature of the skin. Like that is it. Now, the software program converts those temperatures into colors. So if you look over on the right-hand side of the screen here, you can see where these colors are the different representations. The hottest temperature is white and reds, and the coldest temperature is going to be really deep purple and black, essentially. So when this image is created, again, it is all through the infrared camera measuring the surface temperature of the skin, then getting converted into those colors. And then we're looking in each area of the body as if it were a geographical temperature map. Now, the reason that thermal imaging is something that is a very beneficial medical tool is because there is a phenomenon that occurs between the sympathetic nervous system. So this is kind of our fight or flight system to the skin, innervates the skin. And whenever there's any kind of underlying injuries, imbalances, dysfunctions, diseases, infections, anything like that, through the sympathetic nervous system, the overlying skin temperature is going to change. So as an interpreter for thermal images, I know what the normal thermal pattern should look like in each area of the body. And whenever I see something that varies from that, that's something that's going to draw my attention. The other thing is that we know that the human body is extremely symmetrical. So when I look at these images, we're looking everywhere. Is this symmetrical? Yes, yes, yes. And then we get down here and we see where we have a heat pattern that's on the left side of the mouth where there's not one on the right. So again, this is going to draw my attention and tell me that there's something going on there, usually involving inflammation, possibly even an infection. Now, I'll go back here. So the camera is very small. Again, what it's doing is picking up the infrared energy from the body in the form of heat. Again, on the most simplistic level, we're measuring the surface temperature of the skin. The software program, which shows an image that shows up on the computer screen, is again based on assigning different colors to those different temperatures. Now, this is an excellent example of thermal imaging as a physiological test. So this guy is a thermographer in Europe. He took an image of himself and then he drank a massive amount of alcohol and took a picture of himself the next day. So these particular patterns are called mottling patterns. It's spelled M-O-T-T-L-I-N-G, and they represent inflammation in the body. Now, that can appear for many different reasons. Obviously, toxicities like alcohol, cigarette smoking. We'll see them if somebody's got an allergic reaction to something. If you have digestive issues like leaky gut in particular, we can sometimes see these mottling patterns just over the abdomen that can give us an idea that that's what's going on. Autoimmune diseases oftentimes have these patterns. Emotional stress can also be a reason why we can see these patterns show up. So this again is purely physiological. There's no anatomical change that happened to the body in a 24-hour period of time. Now, thermal imaging is the only kind of test that's able to actually detect, this inflammation in the body. Now, all the other tests that we have are anatomical tests, and you can tell by these look very different than the thermal image. In the left upper quadrant there, we have the ultrasound. The head is an MRI scan. The abdomen is a CAT scan. And then the lower image is a mammogram. So in each of these tests, what they're doing is they're taking a cross section of the human body, and it's looking at the underlying architecture. So the only thing it's going to detect is if there has been a structural change to the body. So in other words, it only tells us about something that you already have. These are not preventative. On the other hand, thermal imaging is preventative and can be used as a preventative tool. So I'm trained in Ayurveda, which is a traditional system of medicine from India. Traditional Chinese medicine and Ayurveda both use something called pulse diagnosis. This is very different than what we do in Western medicine, just feeling the number of beats per minute. It's actually based in quantum physics. So we know in quantum physics at the finest level of life, there's these little vibrating strings called the superstring theory, but that vibration is something that actually creates a vibration in all living tissues. So as the blood flows through the body, it comes in contact with every cell and every tissue. It picks up the vibration from that, and then we get information about the health of those tissues and determining whether they have certain imbalances and at what stage. So both of these systems of medicine recognize 6 stages of disease. It isn't until the 5th stage of disease where we get a structural change to the body that a Western medical test can detect. So you can tell that that's kind of late in the game there. So we really want to try to find these imbalances at earlier stages, because at that point in time, they're easily reversible with simple diet and lifestyle techniques. So I liken thermal imaging to pulse diagnosis. With pulse diagnosis, we're feeling the imbalances. With thermal imaging, we're seeing the imbalances. Now, not everything will cause a pattern, a thermographic pattern on the skin. And if you think about it logically, if we're measuring the surface temperature of the skin, anything that's close to the skin is going to cause a thermal pattern. As soon as those start getting further away from the skin, then it's less likely that if something is going wrong with that structure, it's going to cause a thermal pattern. So for instance, head and neck, extremities, the breast, all of those things are close to the surface of the skin. So we see those patterns very clearly if something is dysfunctional there. Once we get it deep into the chest cavity, usually the lungs don't show any patterns on the skin, and deep into the abdominal cavity, uterus, ovaries, prostate, those things are generally not going to cause any kind of thermal patterns. But there's many things that do, and this is just kind of a short list of things that we can see with thermal imaging. So again, this is why it's a very valuable tool. Now, as a person who does the interpretations, for thermal imaging, what I do is I know what the normal pattern should be in each area of the body. And then I'm comparing each person's image to that, what I know to be normal. So if we look on the left side, that's normal. On the right side, we see that this individual has these 2 vertical red lines that indicates inflammation that's overlying the frontal sinuses. Now, the interesting thing that can happen with thermal imaging is because it's a physiological test, what causes the overlying skin temperature to change may actually not be anatomically directly below that. So a really good example of that are the maxillary sinuses. So the maxillary sinuses are encased in bone in the cheeks, and bone does not transmit heat very well. But where it will go is under the eyes. So that we'll see these heat patterns under the eyes, and that tells us that there's inflammation in the maxillary sinuses. Those are the sinuses that are most involved with colds, allergies, sinus infections. So thermal imaging is excellent for dental issues. So for an example, very commonly people may have a root canal. Now, when the dentist is looking in your mouth, you may not see anything going on that's of concern. If an x-ray is taken, there's nothing that's kind of abnormalities that are seen. But with thermal imaging, we may see a really intense hot spot right by the mouth. And that tells me that there's clearly an infection going on. And so then that allows us to have the dentist then check that out, which invariably they do find an infection. And there was no other way that they were going to find that. On the side view, the external ear is always very cold, and anything that's sticking up from the body, like the nose, the external ear, cold. And then anything that causes kind of goes inverts or causes a contour depression, we'll call it, that's going to be warm. So when we do the thermal imaging, we actually need to hold all this hair out of the way here so that it will expose this area right here, which is the TMJ, so the temporomandibular joint. Right behind the earlobe is another area that commonly gets inflamed called the mastoid process. Now, the mastoid process is where all these different muscles will insert that are involved in chewing. And so when these areas get inflamed, sometimes people can suffer with symptoms that you wouldn't quite expect. So it could be headaches, neck pain. With the mastoid process, it can actually cause dizziness. So we get inner ear, issues, or ringing in the ears, can happen. Now, nose is normally extremely cold. In fact, it's so cold it looks black, and that's what our ambient air temperature is. And then the normal patterns, the cheeks are cold there. This person has that kind of focal area of heat that I discussed before that kind of gives us an indication that there might be a tooth infection there. Now, there's a couple different reasons why a person might have an abnormally warm nose. So the most common one is when we have sinus infections going on, or a lot of inflammation, or an active cold. And then we'll have situations where the nose is abnormally warm, but we don't have all that sinus congestion. And there's actually a number of different signs that we have that a person might have high blood pressure. So one of them is that the nose is abnormally warm. We can also, if we have both ears that are abnormally warm, that's another sign of high blood pressure. When I do an interpretation, it's a lot more complex than most people might think. When you get a report done, there's a written report, and then your images are going to be in the report. And this particular, up in the left upper square, is the color scheme or the palette that we use to put into your report. Hang on one second here. Okay, my computer was making noise. Okay, so this is the color scheme or palette that's put into the report. When I do an interpretation, there's actually 6 total palettes that I use to do the interpretation. These allow me to see things that I cannot see in the palette. Oh, shoot. Okay. In this palette here. So for some of them are going to accentuate heat patterns. So you can see in this one, there's the kind of focal areas of heat. The one that's in the center area is, even though it looks black and white, we call it a grayscale. And so this allows me to see with really clear distinction the patterns of the blood vessels, and then also these modeling patterns. The palette in the center lower square is one that accentuates both heat and cold. So if we look up at the one that would be included in your report, you can see where the cheek appears green here. But if we look down at the center lower one, we can see where there's a strip of coolness there. So that's showing us with more detail this, coolness that we cannot see in this one. So this is a reason I always tell everybody, when you have your report done, you might be looking at it and then looking at your images, and you think, I have no idea what this woman's talking about because I can't see it. And the reason is you can't see it in those images that are in the report. We're seeing it with one of these other palettes. Now, the thyroid view, obviously, would be talking about the thyroid. So when, again, thinking of thermal imaging as a physiological test, if we have something that is functioning physiologically that's underactive, it oftentimes is going to show up as cold. So here we see this person who has this blue patch that's right over where the thyroid gland is, and that would indicate that their thyroid is probably underactive and may need some medications, to help to support it. This view is also going to show us if there are true infections in the mouth or the sinuses. If we have that, what happens is that infection is going to drain down through the lymphatics in the neck. Now, this person has all this heat pattern around the mouth, but you see we have no drainage. So that tells us that there is not a true infection, and more than likely it's just either some local inflammation, or it could be that, like, if somebody were to drink hot tea or hot coffee before they have the thermal imaging, we can get that kind of an artifact, we'll call it. So that's one of the instructions beforehand, is not to do that. Now, this is very interesting, where in traditional Chinese medicine, there is an acupuncture point right at the base of the neck and kind of upper back that has to do with the immune system. It's overlying the second thoracic vertebra, or T2 as we call it. And so in traditional Chinese medicine, if the immune system is considered underactive, it's actually described as cool. And so in thermal imaging, it's kind of fascinating that we see, in fact, that there's a cold spot that goes right over where that acupuncture point is. So that tells us that the immune system is struggling a little bit. Now, there is a corresponding point that's right in the center of the chest. This is a little bit less common. This is more common at the base of the neck. But if I see both of them as someone, then I know for sure that this person's immune system really needs attention. So that way we know to focus on the things that can strengthen the immune system. Breast thermal imaging is the most confused area, I would say, and rightfully so, because there's a lot of misinformation that is given out, even by people that are in the industry. So again, we have to keep thinking about thermal imaging as a physiological test. It's not an anatomical test. Oftentimes people will ask me, well, can I do thermal imaging instead of a mammogram? Well, those two tests are giving us completely different information. Again, with thermal imaging, we're looking at physiologically what is going on with the breast. With a mammogram, ultrasound, MRI scan, all of those are anatomical tests that are looking for breast cancer. Now, as I've told you, we can use thermal imaging as a preventative tool. And it's the reason I'm so passionate about thermal imaging, because I worked as a surgeon and I was doing a lot of surgery on women with breast cancer, and it was extremely upsetting to me. And so I really have been focusing on what women can do to help to lower the risk, or if they've had breast cancer, what are the things that they can do to more successfully fight their disease and prevent recurrences. So thermal imaging is one of the tools that we can use that really is spectacular. So let me just show you a little bit about why. So if you look at these two images, you can see where the woman on the left has these red patterns there. Now, throughout the decades, there are various different guidelines that have been established that tells us whether something is considered significant or not. And a lot of it has to do with are the breasts symmetrical? So whenever we have one side, a pattern on one side that we don't have on the other side, it may be an indication that it's significant. We also look at the absolute amount of heat in that pattern. So I'm doing absolute temperature measurements between the two breasts. We also look at configuration of the pattern. So there's many different things that kind of play into it. But what the research shows, and amazingly, there's been 800 published studies in the medical research on the topic of thermal imaging and breast cancer. And what that research shows us is that when women have any of these significant patterns, it tells us that there is an increased future risk of developing breast cancer. Now, can thermal imaging show breast cancer? Yes, it can. But, we want to use it as a preventative tool because it's the only preventative tool that we have. And all those other, examinations, the ultrasounds, the MRI scans, and mammograms are going to show us if someone has cancer. So we want to use it as a preventative tool. Now, this person on the left is actually the same person on the right 3 months after she improved her diet and her lifestyle and took certain key nutritional supplements. So the breasts are extremely sensitive to diet and lifestyle. Emotions and stress play a huge role, as well as nutritional supplements. So I have a program that I actually have women do. I call it my full court press diet and lifestyle, and then add certain key nutritional supplements. These include vitamin D3, omega-3 fatty acids, and then 2 two that are more breast health specific, and one is called Prevail. B is in boy, R is in Roger, E is in Edward, V is in Victor, A is in Apple, IL, Prevail. So that's the lignans from flax seeds. And then also there's a supplement that I formulated with a Integrative Therapeutics, which is an extremely reputable supplement company that's got 7 different nutrients in it that have phenomenal anti-cancer effects for the breast. So as you can see, in 3 months, you know, we go from this, which is considered high risk, to this, which is completely normal. So that way we have now reversed that process. We're interrupting the process of it developing into a breast cancer. And again, being able to monitor breast health, jump in there whenever we see any imbalances and get those things to reverse. So this gives you incredible power, you know, over your health. And allows us to really monitor things. So here's just another instance where you can see, if we're looking at symmetry, the left breast is a lot warmer than the right, the left nipple's a lot warmer. We have this closed circular pattern, which is one that carries a little bit more risk with it. Did the same thing, the full court press diet and lifestyle for 3 months, added the nutritional supplements, and this is what she looked like 3 months later. So, I mean, to me, this is just the most valuable tool we can possibly have, and I recommend this for everyone. I'm going to skip through. This is all about the research. Now, on the abdomen, the belly button is normally hot, and then it's surrounded by coolness because there's usually a little bit more extra fatty tissue there. When we get digestive issues that are going on, we get more vague patterns that'll show up. So sometimes we'll have those modeling patterns like I showed you in the man that drank the alcohol. We also commonly see these vertical patterns on either side of the abdomen, which we think are dilated lymphatics. So this can tell us that maybe there's some leaky gut going on. Oftentimes we'll find things, patterns that are showing digestive issues, and a person may have absolutely no symptoms at all. So this is the thing about how great it is to be able to pick these things up at early stages before somebody's having symptoms, because it's so much easier, you know, to treat and reverse that way. So it's great to have like a naturopath or a integrative, you know, physician working with you that can really focus on strengthening your digestion. This is a woman who didn't drink alcohol, but just had severe inflammation in her body. And again, inflammation is something that really drives all the different chronic diseases, from dementia to heart disease to diabetes to breast cancer. So we really want to minimize that inflammation. This is just a chart showing all the different reasons why somebody might have those inflammatory patterns. And I discussed that a little bit earlier. But, you know, my job is whenever, you know, somebody has those kinds of patterns, I talk with them and figure out, okay, what's the most likely cause of it? And then we know how to approach reversing that and getting that inflammation down in their bodies. In the low back, the normal pattern is to have a vertical heat pattern over the spine. So this is normal. Now, chiropractors who are familiar with thermal imaging really enjoy using it because they don't have a test other than, you know, x-rays, but they don't have a test that's going to show them the condition of the soft tissues. So thermal imaging allows the chiropractor to kind of locate where's the area of the most inflammation. And then based on how some of these patterns appear, it can actually tell us something about what's going on there, such as like a subluxation. Bottoms of the feet, the left side is where the feet are normal. So they're really cold. The toes you usually can hardly see. And then there's symmetrical heat patterns that are on the instep. When we have more heat on one instep versus the other, this is oftentimes something that we see if somebody's got plantar fasciitis, or if they've had an ankle injury on that side. Sometimes we'll see those patterns for even years, you know, afterwards. There's also where we see various different locations of heat patterns on the bottoms of the feet, which are most likely due to gait abnormalities. But one hugely valuable aspect of this is that if a person's a diabetic, one of the worst complications that they can have is to develop a diabetic foot ulcer that may lead to amputation. So with thermal imaging, we can actually see areas before the foot ulcer appears and be able to, you know, jump in there doing kind of preventative measures so that they actually don't develop that diabetic foot ulcer that could lead to amputation. Now the hands on the lower left is what the normal appearance is. So they're kind of like the feet. It gets colder and colder out to the tips of the fingers. There's a little bit of heat at the base of the thumbs because we're using our thumbs a lot. So whenever there's increased blood flow, we're going to see some increased heat. When we have heat on one side and not the other, this could indicate arthritis. There's also conditions where the hands start to become abnormally warm. So when we get to the point where the entire hand is warm like this is called a glove pattern, and it's almost always associated with increased blood glucose. So this is allowing us to pick up people that may be pre-diabetic or diabetic, and some don't even know. So it's, that's a helpful thing. Now, another example of or indication of high blood pressure that we pick up with thermal imaging can be if the fingernails are red hot or white hot. And again, when we combine that with the nose and the ears, I talked to you about that before, those are all, huge indications of having abnormal high blood pressure. On the palms, we expect kind of mild, heat patterns. Sometimes we'll have heat on one side and not the other. That could be an indication of carpal tunnel syndrome. And then some of them has to do with, the heat patterns can do with how much a person uses their hands and what their profession is. So again, I'm going to stop this screen share. Thermal imaging to me is just like the most incredibly valuable tool because it's completely non-invasive. It's totally safe, even for babies. It's FDA approved, no radiation, is pain-free. Incredible way to be able to have kind of a window into your body to see things that no other test, can pick up and allow us to really, get in there as far as our prevention and have our preventative techniques really guided by what your thermal patterns are. So I encourage you so much to look into getting thermal imaging done, and I look forward to meeting you.